First, I'm going to wash my hands when I enter the examining room. Good morning. My name is Shaquila. I'll be taking care of you. Can you tell me your name?
Michael.
Hi, Michael. Do you give me permission to record this video and upload it for my teacher to grade and view?
Yes.
Okay, thank you. First, I'm going to start by inspecting my patient. I'm going to inspect his eyes. I'm looking for any jaundice in the eyes, and then I'll start inspecting his stomach. While I'm inspecting the stomach, I'm looking at the contour of the stomach, which is nice and round. I'm looking for any bruises, any scars, any drainage, any erythema, any jaundice. He has none of that. Everything looks good. Next, after inspection, I'm going to auscultate. I'm going to auscultate all 4 quads of the abdomen, listening for bowel sounds. I will listen at least 5 minutes or until I hear bowel sounds. If I don't hear them within 5 minutes, that would be hypo, but I'm going to listen to his. I heard his bowel sounds in all 4 quads. That is normal active bowel sounds. Next, I will auscultate the arteries. I will start with the aortic artery, which is 2 centimeters above the umbilicus. And I'm listening for a bruit. I will listen with the bell and the drum. Do not hear bruit. Next, I'm listening at the renal arteries. I'm going to listen with the bell and the drum as well. Did not hear bruit. Next, I'm going to listen at the iliac arteries with the bell and the drum. The same thing on the other side, the iliac artery. Listening with the bell and the drum. Did not hear bruit. Next, I'm going to listen to the femoral arteries with the bell and the drum on each side. And I did not hear a bruit. After auscultation, next I would do my percussions. I'm going to percuss all 4 quads of the abdomen. And I'm listening for tympany or dullness. Tympany is normal findings in the abdomen that shows that the fluid is in the abdomen. If I hear dullness, that's an indication of enlarged organs or mass. After I palpate the abdomen, I'm going to palpate the spleen on this side. And I hear dullness, which is a normal finding for the spleen. Next, I'm going to palpate to find the liver's edge on this side. I'm going to start low until I hear dullness. I hear dullness, which is 1 centimeter below the right mid-clavicle line, which is a normal finding. Next, I'm going to percuss for the liver span. I'm going to percuss until I hear dullness, and I mark it with a marker, and then I'll percuss and I'll go up and I'll percuss in between the rib cages, and then I'll mark it and I'll measure the 2, and his is 7 centimeters, which is a normal finding. Normal finding on the right clavicle side is 6 to 12 centimeters, or you could do it mid sternal, which is 3 to 6 centimeters. Next, after I percuss the liver, I will percuss the kidney, the bladder. I'm sorry, the bladder. I hear tympany, but you could hear dullness. Tympany is a normal finding. Dullness could indicate that they have a full bladder. You can ask your patient to go into their bladder and percuss that area again. Next, I will I percuss the spleen. So I'm done with my percussion. Next, I'm going to do my palpations. Palpations. I'm going to do light palpations in all 4 quads, asking him if he feels anything. Feel anything?
No.
Feel any pain?
No.
Feel any pain?
No.
Feel any pain?
No.
I'm just feeling for any pain or any tenderness. If he did have pain, I would not do deep palpation in the area. Next, I'm going to do deep palpation. I'll put one hand and put another one on it. Do you feel any pain?
No.
And I'm feeling for masses or enlarged organs when I'm doing my deep palpations. Okay, he did not feel anything. That's normal. So next, I'm going to palpate the liver. I'm going to reach up under here and have him take a deep breath. Take a deep breath and rub my hands down on the edge and release it. And you can feel the liver in smaller people. Sometimes larger people, you can't really feel it that well, but you usually can feel about 3 centimeters of the liver when they inhale. Next, I'm going to palpate the spleen on this side. Can you take a deep breath? Okay. And exhale. And I did not palpate the spleen, which is a normal finding. You should not be able to palpate the spleen. And if you do, it's an indication typically of splenomegaly. Next, I'm going to test, do my special test. I'm going to check for cholecystitis, which is the Murphy's test. I'm going to press in the right upper quad. Have him take a deep breath. Take a deep breath. And if he sighs, that's a positive Murphy sign, because the gallbladder is inflamed on inspiration and it'll irritate it. And if he doesn't, it's usually a negative sign, but that's the way we check for cholecystitis. My next test would be Robson sign, and that's testing for appendicitis. I'm going to palpate the left lower quad. And if the pain defers to the right lower quad, that's a positive sign of appendicitis. My next test is going to be the fluid wave test. I'm going to have my patient, can you press down in the mid of your abdomen? There you go. Thank you. I'm going to tap on this side and feel for waves on this side. I'm going to tap on this side and feel for waves on this side. Thank you. That's a test we test for ascites, and it will show that it's fluid in the abdomen. And the next test, I'm going to test for CVA tenderness. I'm going to have my patient sit up. Can you sit up for me? And I'm checking for polynephritis, so I'm hitting the kidneys. I'm going to put one hand and get a fist and hit that side. Put that hand and get the fist and hit that side. And if it's tender, if they squinch up or anything, that's usually a sign of polynephritis. And that's the end of my assessment. Thank you so much for watching.